Hi, I am Dr. Kumar Prabhash. I am Professor Medical Oncologist at Tata Memorial Hospital, Mumbai. Clinical trials are very important to develop treatment for any patient and including the cancer patients. This is very well developed and done routinely outside India, that is especially in Western world. In India, we do have trials done, but they are very far and few. And I think so that is one of the very important lacuna for development of treatment in cancer patients in India. As I said, in general, the clinical trials are very far and few, and metronomic trials, as these are the drugs which is usually already available and they are used in lesser doses and more frequently, and there is no patent issues on that. More often than not, pharma companies are not interested. So, burden on development of these drugs and the schedule comes on the investigator and the treating physician. In India, we do have trials which we divide as pharma trials or investigator initiated trials. Pharma trials, because of regulatory issue, has been had a problem in the past, but which is improving, but we do understand they can handle these things better. But in a situation where pharma does not pitch in and then an investigator or clinician has to do a trial, the incentives are so few and regulations are so tough that usually it is not done. And same is true for metronomic chemotherapy trials, which I mentioned, that this is the repositioning or using the drugs which is available in a different way. So, metronomic chemotherapy trial also are very far and few. There are some of them, but that needs lots of encouragement. If you want newer modality, newer treatment or effective treatment to be investigated in our own country and have our own treatment, because at this moment, more often than not, we take the data which is available from the Western population and we use for our own patients, which I do not think so is the best way to do. But till we have our own trial, we are compelled to use those data which is available from abroad. So, it is a very important question which you have raised. We do know that we are ethnically different from the Western population, and this issue will be always there, that are the drugs which are used in India, which are used abroad, have a similar efficacy and similar toxicity. There are some data to suggest that the different ethnic population, they do have a different kind of responses to certain treatment and different kind of toxicity to the certain treatment. For example, docetaxel is used at 60 milligram per meter square dose in lung cancer in Japan as compared to 75 milligram per meter square in Western population. So, we do understand when investigated, we do find that these drugs may behave differently in different ethnic population. This is possible that this may be true in Indian population also, and these needs to be investigated. So, that is why I emphasize again, till we do not have a data, we are compelled to use the data which is there from Western population, but we need to strive and work hard to ensure that we develop data from India for our own patients population. There are a lot of challenges in a clinical trial. Clinical trial is a tedious process, lots of hard work is required, and if I need to enumerate, it starts from asking the right question, having the right researcher and the clinician who is interested, especially when I am talking about primarily investigator initiated trial. Then we need to have proper infrastructure, we need to have some cooperative group where the people come together and work, and apart from that, funding, where the trials does not benefit pharma directly. Issue of funding comes in because you hardly have any funding available for drug development in India at this moment, and very important one is the regulatory issue. At this moment, except for some exception, the regulation for pharma development of the trial and the investigator initiated trial, the rules remains the same, and that becomes a strong deterrent in development of the trials, because if you follow the same rules which is there for pharma as compared for an individual clinician or the center, they do not have the resources to do these kind of study at present. So, challenges are multifold. So, to have more clinician trained to do the study, more centers trained to do the study, regulators needs to be educated at multiple level to understand the differences in the nuances of different kind of trial. Having a body where they can have funding which is available for investigator in said trial where pharma doesn't pitch in, and regulations which are different for different kind of trial depending upon the risk for the patient, rather than having a similar kind of regulation and similar kind of regulation and implementation of the rule where the risk for the trials are different in these population. So, I may start with the clinician. So, if you take the per 100,000 population, the clinician what we have in India and Western populations are very different. We know that we can't change it immediately, but we can try hard to make it possible as the time goes by, but I do understand this is tough to do. Second is infrastructure. Infrastructure, as far as I can understand, in today's time we do have enough resources that minimum infrastructure for trials can be facilitated at multiple hospitals which are especially the referral hospital in this country. So, this can be done with the resources available in today's time. Third, coming to funding, we do know our funding is limited as compared to Western population, but we do understand in many of the funding agency we do have a significant amount of resources, but these resources are not shared for drug development. These resources are primarily for answering the biological questions. So, we think these resources need to be segregated in a way that a part of resource is kept for drug development, which is important for our patients. And the last, and which is very important and which if done may be able to take care of many of the other limitations which is available in our country, is the regulation. As the regulation is so tough and cumbersome and difficult to interpret, that most clinicians are not interested in doing the study. If we make it liberal, but we ensure a strict implementation, what we need to make it liberal, but we need to ensure that certain things has to be implemented, then I think so we will be able to have many clinicians who are interested in doing this research, and they will work hard to try to circumvent this issue of time and infrastructure and develop them to ensure that they learn this and also our patient benefits. If we see pharma trials, you get many centers who do it, because there is direct incentive to the clinician, I will say financial incentive to the clinician, especially in private sector, we do not have in the government sector, but I think so that is a fair way of doing it. But having said that, I totally agree with you that there is no direct incentive of doing investigator initiated studies at this moment in India. I totally agree, we need to have certain incentive either in way of providing manpower, infrastructure, funding, recognition to the clinician, giving certain dedicated time to do the research work, maybe some financial incentive which is allowed in the rules. And I think so if we do this, then we should be able to attract many more clinicians in this academic center, and hopefully then they will contribute more to the research. And that in fact I totally agree with you that this is the reason that we are not able to attract clinicians today in the academic centers, especially because they do not have certain incentives which differentiates them, because of they do this research work as compared to people not doing otherwise.